So this evening's seminar is going to be all about pelvic floor physiotherapy for bladder cancer patients and how we can manage some of the postoperative complications that come about. So as Michelle pointed out, I am a registered pelvic floor physiotherapist. I've been working with men, women, and children who suffer from various forms of pelvic floor dysfunction. And I've been doing that for over a decade. So in that time, I have acquired a special interest in men's health, and that's primarily because there's really a lack of pelvic floor physiotherapists out there who specialize in men's health. And then later, as I continued to work with men, I realized that there was a gap in the way in which we provide care for patients. So what's in the evidence and then what's actually being practiced in healthcare are two completely different things. And so naturally that motivated me to pursue my doctoral studies so that I can improve that quality of care that we provide to patients and ultimately improve the outcomes that they have. So today's presentation is going to be covering what is pelvic floor physiotherapy, how it can help with the postoperative complications, and then we're going to discuss some of the interventions that physiotherapists do for their patients, and then finally we'll have an opportunity to actively participate in strengthening our pelvic floor muscles. Now, I will preface this presentation by saying that it is geared towards patients who have had the orthotopic neobladder reconstruction, and that's because this is the most commonly referred to pelvic floor physiotherapists, and that's because they have to use their pelvic floor muscles in order to have the best outcomes. So what is pelvic floor physiotherapy? How many people in the room here have heard of pelvic floor physiotherapy, or perhaps? Yeah, okay, excellent, excellent. So never a lot, but at least there's a few more than I see in some crowds. So it is an evidence-based treatment option for the management of various conditions that present themselves in the pelvis. And those conditions can often look like urinary conditions, bowel conditions, and also sexual dysfunction. And the pelvic floor muscles are housed in the pelvis. For those who aren't familiar with the pelvic floor, they are all those little red muscles that you can see inside the pelvis, and they're hidden deep inside. And they also don't move us, so most of us are very unaware of the existence of these muscles, but let alone how to activate them. So traditionally, patients are often told, okay, well, here are some written instructions or verbal instructions as to how to strengthen their pelvic floor muscles. And unfortunately, that doesn't work because most of us are unaware that these muscles even exist. And then that leads to very frustrating outcomes for the patient. So pelvic floor physios will actually perform an internal examination where we can effectively assess the state of the pelvic floor muscles. These muscles can have a tendency to become overactive. And when they become overactive, strengthening them would be the least appropriate thing, right? If your muscle is stuck like this, you're not going to go to the gym and do some biceps. The first inclination you'll have is to, how do I lengthen that muscle? And so just by giving somebody the Kegel exercise on a written document isn't necessarily going to be the most appropriate intervention. So we have to address or assess those muscles internally, and that's the gold standard. However, I can appreciate that not everybody is comfortable with an internal exam, so there are ways in clinic that we can assess the pelvic floor muscles externally. But it does often require hands-on approaches to really effectively assess the state of that pelvic floor. So whenever I work with my patients, I always give them a little anatomy lecture so that they understand where these muscles are located and how they work. So what we see here is the female anatomy, and the muscles of the pelvic floor are divided into three layers. So the first layer is the muscles of sexual function. They wrap around the clitoris and around the opening of the vagina. The ability of these muscles to lengthen and contract through their full range of motion will ultimately improve one's pleasure with sex. The same thing holds true in the male, where the muscles essentially become the shaft of the penis. So the strength of these muscles can improve the rigidity of the penis and the staying power. The second layer, we can see, are responsible for the sphincteric function, or basically urinary control. They are identical in both the male and the female. The only difference is, of course, we would have a few extra muscles to provide some extra stability for the opening of the vagina. And then the third layer are the deepest muscles, and they act to support the internal organs, so the bladder, the bowel, the uterus, prostate, depending on the sex. And they also help to stabilize the back, the hips, and the internal or in the pelvis itself. So if you can imagine, if you have back problems or hip problems, then that could potentially impact the function of the pelvic floor. So if you happen to be a chronic back sufferer, then you want to have that assessed. And that's something we never overlook when we're addressing pelvic floor dysfunction. And then the sump pump function. So this is the really key function. And the sump pump function, particularly in the bladder cancer patient, is there's a tendency to have a lot of the lymphatic system removed from the pelvic region, and that can lead to a condition called lymphedema. So this sump pump function is essential in making sure that that fluid properly gets exchanged through the system, running from the feet all the way up to the head. And if that system isn't working appropriately, then you'll get a backup of fluid that basically pools in the pelvic region, and that can cause disruption to the function of those pelvic muscles. Does that make sense? Yeah, okay. So, and the exact same third layer holds true in the male anatomy. What I do want to bring your attention to here, though, are the triangles. And you can kind of see that the front triangle, which is responsible, so it's going to house this section, so the sexual function layer, and it's also going to house the urinary control layer. And that lives directly in this urogenital triangle. The back triangle is called the anal rectal triangle, and we want to make sure we focus on this front triangle. So technique really matters when you're learning how to strengthen these pelvic floor muscles. It's not just about doing a Kegel, and in fact, Dr. Arnold Kegel developed that technique for women back in 1940. And if we keep applying those same techniques in the male population, then we're not going to have the same results or the desired results that we're looking to achieve. So technique matters. This is an animation from Paul Hodges and Ryan Stratford out of Australia. They are leading gurus in the area of men's pelvic health. And this is a beautiful representation of how the muscles move. So the muscles we just looked at are all these muscles in red. And with the advent of transperineal ultrasound, we've been able to see how these muscles move. And the beautiful thing is, as I just said, in that front triangle, these are the two muscles. That's the one that goes around the urethra, which is where the bladder evacuates its contents, and that's the muscle of sexual function, and they're in the front triangle. So the nice thing about isolating and strengthening those muscles is that when they contract, they scissor down on the greatest curvature of the urethra, which would be ideal, because if you're trying to stop water from coming out of hose, you're not just going to pinch it. Right? You're going to hold it, and that's going to be more effective. So when we're trying to isolate these muscles, that's going to be the desired outcome. Now, for the bladder cancer patient, there's a couple things that need to happen. It's not all about strengthening the pelvic floor muscles. Yes, you need to be able to contract them effectively, and you need to have enough strength and power in these muscles. But on the flip side, you also need to know how to relax them and create like above pressure in your core to allow for effective voiding of the neobladder, which is a tricky feat, right? To try and coordinate that isn't easy, and that's where pelvic floor physiotherapy comes into play, because it helps you learn how to do that effectively. So we talked about incontinence as being one of those side effects that takes place, but what happens is when they did a study where they provided participants with a questionnaire, and they wanted to determine what their urinary function was 1 year after orthotopic neobladder reconstruction. And what they found was nighttime pee or nighttime incontinence is much more severe than daytime. And so they found actually 72% of individuals had to still wear a pad at night at a year follow-up. And they assume that that's because of the absence of the reflex that exists in the bladder and the prostate. So once you lose those two organs, then that reflex is no longer there to help you maintain your continence through the night. And then there's also perhaps a decrease in function of this muscle here. And then there's also this increased or potential for increased urine production at night, which can be improved by using desmopressin, which is a medication you can talk to your doctors about getting, and that can help decrease the amount of urine that the kidneys produce through the night. But other techniques would be to stop drinking fluids 2 to 3 hours before bed, and avoid sleeping postures like you see here, and this would be your optimal sleeping posture where you have the pillow there. And all of that is just to reduce the amount of pressure that's acting on the bladder, or on the neobladder in the core. So the other type of urinary dysfunction is your hypercontinence. And this situation here is incredibly important to make sure that we are maintaining a time voiding schedule. This ends up happening because the bladder overstretches, the neobladder overstretches, and it's no longer a muscular structure, right? The bladder is a by itself, in its natural form, is a muscle that contracts. But because we don't have that capacity here, if we don't follow this time voiding schedule, that bladder will overstretch, and then you'll end up in a situation where you're going to have to self-catheterize, which was the whole intent of not having to do that with going with this type of surgery. If you want to talk more about that schedule, I'm happy to answer questions later at the end of the session. So here I am in all my glory on a toilet, sitting with my feet on a squatty potty and twisting and doing the fist blowing technique. So as I mentioned at the outset, we want to increase the pressure coming from above by using the muscles that are called your external obliques. And then we want to relax the pelvic floor muscles to effectively empty the contents of the neobladder. And this is the technique that I found to be most effective. Basically, it involves blowing through your fist. You guys can try it and see what happens when you do it. So you basically close your fist and make it as though it's the hardest balloon you've ever had to blow up. And when you blow and your cheeks should puff out, you should feel instantly that your core activates. Now, the tricky part is, can I let my pelvic floor relax simultaneously? Okay, so that's the tricky part. And so the core muscles are incredibly important in this patient population, and also learning how to relax these pelvic floor muscles. Each of these exercises, you'll see, start with this thing right here, a diaphragmatic breath. So how many people know where the diaphragm is located? The diaphragm is your major muscle of respiration, and you can see it here. Okay, it literally goes from the front of your sternum all the way around to the back. So it's this huge muscle that lives domed up inside of the ribs. Okay, so up in here. When you inhale, that muscle flattens out like a stingray. And that essentially affects the pelvic floor. It causes the pelvic floor to lengthen. And so the breath is incredibly important. And a lot of people, if I ask people to breathe here, 99% of you would breathe shallow and you'd suck in. But when in fact, the natural breath should happen diaphragmatically and the abdomen should extend out, allowing the pelvic floor to drop. And again, these are techniques that are not common, like people don't do this day to day. So we've got to start thinking about ways to effectively do that, and a pelvic floor physiotherapist can help you with that. Having your feet up on a squatty potty, by the way, also relaxes the pelvic floor. So we're just trying to optimize that ability to effectively void. This is another strategy that's been shown in the research called the Crede Maneuver. It's essentially the same thing. You find your pubic bone, which is the hard bone down below, and then you go into soft tissue, and that's essentially where your neobladder is located. Then you would take that deep breath in. It always starts with the breath, and then you exhale and push. And that again helps get the contents of the neobladder out. Okay, so what else happens? Well, there's going to be a significant amount of scar tissue that develops. And the problem with scar tissue is that if it's left unaddressed, it has a propensity to tighten over time. And it will continue to tighten if left unaddressed. And it'll affect the tissues that it adhere to more and more as the years pass by. So we have to make sure that we address this. And how do we address it? Well, we can do manual therapy, learning how to massage that scar tissue. But the more effective way would be to do strengthening of the muscles, because the muscles remodel the scar tissue along the lines of stress. And that's where core strengthening is absolutely key in this patient population. Because I just finished saying how they're going to be useful for effectively voiding the bladder. Okay, and so what we want to see here is that this is your inner core and this is your outer core muscles. Oftentimes, what happens is that these patients can be at risk for an incisional hernia. So we want to make sure that that is avoided through proper core strengthening. And then the other important thing is that if these muscles are cut through, because you're not just going through the skin, right? You can't just address scar tissue superficially. That scar tissue goes all the way in. So you've got to get into the various layers. But when this system becomes impacted, this is your inner core, and these muscles all work with the pelvic floor like gears on a bike. And if you know anything about gears, if one gear doesn't move, what's going to happen to the next? It's not going to go. So all of these muscles have to be considered when trying to optimize the function of the pelvic floor. Does that make sense? Mm-hmm. All right, so if you're taking out a piece of the intestines to create this neobladder, and by the way, I've seen this surgery, it's nothing shy of a miracle. It's absolutely fascinating how they do this. And if you're removing a piece of the intestine to create that neobladder, the chances of having constipation or diarrhea or digestive disorders is very likely, and it actually happens in 50% of the people who had this type of surgery. So how do we manage some of these? Well, in clinic, we teach the patient how to do an I love you massage or an ILU massage, and that just basically is following the lines of the colon to help move the stool through, and we teach patients how to do that. Then there's this constipation series. Again, notice it starts with the breath, okay? And that's because the diaphragm is a major muscle of helping with digestion. Beyond just being a muscle respiration, it also, every time it contracts, it allows the stools to move through. So we've got to make sure that we optimize the strength and the function of the diaphragm. And so this whole series is going to be demonstrated on a free webinar that I'm providing everybody who's here this evening on Wednesday at 6 p.m. We're going to go over all these exercises and more so that you can start learning how to improve the quality of your lives. And of course, seeing a dietitian is going to be absolutely helpful in trying to manage some of those gastrointestinal conditions that you may experience. Now, we talked about lymphedema being another concern that can happen postoperatively, and there's a series of exercises here. Again, notice diaphragmatic breathing. It keeps coming into play because it's such an important muscle to help with all these postoperative complications. And again, we go through a series of exercises that can be performed first thing in the morning and at night, and we'll go through that again next Wednesday should you guys want to come and learn. All right, so erectile dysfunction, another unfortunate side effect of these types of surgeries. And this can happen because whenever you disrupt the nerves that innervate or activate the penis or the vagina, this could cause a temporary loss of nerve function and structural damage to the nerves itself. And this is a condition called neuropraxia. So when this happens, it can take 2 to 4 years before recovery occurs. And it causes a vascular shutdown. So what ends up happening is that you lose your ability to have erections. And that becomes a problem because when your penis does not engorge sufficiently, you have a signal that gets sent to the brain that basically signals deposit scar tissue. And when that scar tissue is there, it doesn't ever go away. Neither does the scar tissue you have. We can only just remodel the scar tissue, but it stays present forever. There's no way of removing it. So we have to make sure we stay on top of it. And that's why early penile rehab is extremely important. These are the various ways that we can work through treatment options for penile rehab. But the ones that I'm going to draw your attention to are the pelvic floor muscle training and the vacuum erection device. So these are the two vacuum erection devices that I've used. I particularly prefer this automatic version. I found it recently and I love it. It works really well. And essentially through negative pressure, it draws blood into the penis, creating an erection for the man. It also maintains length of the penis. So it's like stretching for the penis to preserve that tissue over time. Okay? All right, so here we are. We're going to learn about how to strengthen those pelvic floor muscles. Now, remember I said that there's a chance you might not ever sense any of this today. You might sit there and I'm going to give you instructions and you're going to be like, I don't know what she's talking about. But that's what I was alluding to earlier, is that this is why written and verbal instructions aren't always the most effective way. So if you're struggling, don't hesitate to reach out to me. I'm happy to do a one-on-one with you to help you. Okay? All right, so let's try this out. I'm going to ask everybody to come to the front of their seats. Just move right to the edge of your seat if you're willing to participate and learn. Okay, and what I'm going to ask you to do is try and copy me here. So we're going to come to the front and you're going to find your 2 sit bones. So if you place your hands under your bum, you'll feel like 2 hard bones. And you're just going to spread your legs open a little bit because it's going to allow for the pelvis to move a little bit better. If you're closed like this, the pelvis can't move freely. Okay, so open those legs, sit up nice and tall. Yep, and what we're going to think about here is just hinging forward. I don't want to see this, okay, because that puts pressure here, so that's not going to be good. We're hinging forward. If you have a table in front of you, you can put your arms on a table, or you can just rest your forearms on your thighs. Okay, from this position, I want you to think about contracting your pelvic floor muscles. The cues that we give are trying to perhaps stop the flow of urine, or move your penis, try to bring your penis towards your body. Okay, whichever cue works best for you, but think about that. And we're going to squeeze for a second and then let go. Squeeze for a second and then let go. And what you should feel, keep going, keep practicing, what you should feel is a tightening happening between those two sit bones. Squeeze, release, squeeze, release, squeeze, release. You shouldn't feel any tightening going on in the glutes. You shouldn't feel any tightening going on in the core, maybe a tiny little bit of tightening going on deep. Okay, are we feeling that? Okay, good. So you would do 10 reps of this at 100%. So this is a power contraction. You're trying to develop the power muscles in the pelvic floor. The pelvic floor has power muscles and endurance muscles. So you want to make sure that you're training both, not just the power, but also the endurance. So how would you train the endurance? You would just hold that contraction for 10 seconds while talking out loud, having a conversation with someone. It's not just about holding your breath and, oh my God, 1, 2, 3, 4, 5, 6, 7, 8. It's about being able to do this in normal day-to-day activities. And that's the tricky part. Now, we're all doing this in sitting, but the reality is leakage typically doesn't happen in sitting. It happens in transition, or when we're standing or walking or we're doing things. So very quickly, you would have to progress to a standing position. And so what I make sure everybody does when they go from standing, actually, you know what, let's just try something. I just want you to go into bad posture for a second. So just slouch. Let's try that same thing. Try to stop the flow of urine. Where do you feel that now? Do you remember that image I gave at the very beginning of the two triangles? Didn't that just shift into the back? So this is where technique matters. How you train is going to help isolate the muscles that you're looking to improve. Can everybody feel that? Okay, that's really critical, all right? And then, so now when we go from sit to stand, that tends to be a moment of leakage. So when you go from sit to stand, contract your pelvic floor muscles. It doesn't need to be 100% here because you're gonna hold this for a bit. So hold that pelvic floor and then just breathe and stand up. And try to hold it, okay? Now I see a lot of people, scared? Oh my God, I can really do it. But that's where, as you practice more, you can start to relax and let everything go. So hang on, stay up, stay up, stay up. Now we're gonna learn the standing because now you've got to feel, can I actually do this in real life or do I need the support from the chair? And that's where you're gonna see how strong is my pelvic floor. So everybody move into the ski jump position. It's almost like the next thing that's gonna happen is you're gonna fall. It's not a hinge, okay? All it is just a shift forward so you almost feel like you're about to fall. In that position, you can place your arms behind you to give you some support. Like not just kind of, like this, just like a skier about to jump. That's it. Okay, just counterbalances you. And let's do it again. Let's contract 10 times. Ready? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Did we feel it as much? It's harder in this position, right? Because now the pelvic floor doesn't have the support. But this is why you have to train in functional positions, in positions where you would have incontinence. A lot of people tell me I train on my back. It's gonna do for you. You don't lean on your back. Well, you do in some cases, but you have to make sure you train in all circumstances. Now, just for fun, let's do this. Just bad posture. Put your weight in your heels. Let's do it again. Squeeze, 2, 3. Where's that going? In that back triangle again. Useless. Come up tall and move forward. And then do it. Now, everybody, I just want you to have a conversation with somebody next to you. 10 seconds. For 10 seconds, talk and hold that pelvic floor contraction. Don't let it go. Don't let it go. Keep going. 5, 4, 3. Keep holding it. Don't let it go. 2, 1. Okay, now let it go. Okay, so see how that changes everything. Now the pressures start acting. Everybody can have a seat now. Thank you for participating. I appreciate that. So, according to the bladder cancer research, they do say that you want to work up to 60 seconds. So what I tell my patients is if you're going for a walk and try to hold it. So I'm getting out of the shot here. Walk and try to hold the pelvic floor for 30 strides, for 60 strides. Try and think about ways that you can start using your pelvic floor for a period of time to build up to that 60-second tolerance. I'm not saying that that's going to happen on day 1. Okay, that's something you work towards. Just the same as holding it for 6 seconds. 100% power for 6 seconds, that's not easy. That takes some effort, okay? And that takes some work. Any questions about that, or are we gonna wait till the end? Probably wait till the end. Yeah, okay. All right, so the take-home message, technique and intensity matters. We wanna isolate that front triangle. We want to remember that motion is lotion. We got to keep moving, and we've got to do the various exercises that we will go over on Wednesday night at 6 p.m. virtually. Pelvic floor muscle training enhances strength and blood flow to the external sphincter, so this can promote healing and recovery. And what I didn't mention is that if you have the opportunity of getting to a pelvic floor physiotherapist before your surgery, that can greatly improve your postoperative outcomes. So 6 weeks pre-op makes a big difference in the aftermath. And also, for those who don't necessarily have private insurance for physiotherapy, one single session can really make a difference in the overall quality of life. So with that, I thank you so much for your attention. You can visit my YouTube channel, my website, for more exercises that target your inner core and various other body parts. And this is where you can reach me, Christina at newlife.ca, to sign up for that virtual session. Thank you so much for your attention.